I'm Harris County Judge Lina Hidalgo, and I wanted to just walk you guys through what we're seeing in our hospital population. So we have here the general population in hospitals for COVID patients, and we went over this at a press conference, but I wanted to make sure everybody had a chance to see the chart. This is last updated 2 days ago, so on the 15th, and we're using data from CETRAC, which is the agency that helps coordinate the different hospitals on these kinds of issues. So you'll see 2 weeks after the stay home, work safe order, 14 days, the curve flattened. Of course, hospital population for COVID started at 0 and it had been climbing, and then you can see the tail end of it here, and eventually it flattens out. Then we have phase 1 reopening. It looks good, actually comes down a little bit, but as you hit 2 weeks after phase 2 reopening, a little bit before that, you start seeing the cases climb. Since then, we've had Memorial Day, Mother's Day, protests, phase 3 reopening, more and more contacts. So that's also the concern, is that these numbers are only going to get higher because we've had more and more contacts since then. But what we're seeing here is the impact of what happened 3 weeks ago, 4 weeks ago. And the blue line is just a visual aid. It's a 7-day moving trend. It's not statistically significant. But these lines here, the red line, the red dotted line, and the purple line, those reflect the change in patients' 7-day trend and 14-day trend at a 95% confidence level. So these are both statistically significant, and what we see is those cases really continuing to rise. They're accelerating. So the trend over 14 days was 22 patients a day, 7 days 31, and we've been seeing this over the last couple of weeks. At one point it was 8, and then it was 12, and now we're at 31. So that's the concern. Do we have enough hospital space? Yes, we have plenty right now, but if we continue going in these trends, if we continue that acceleration, eventually we're getting to a point where we're putting that space in jeopardy. We have surge capacity, but those beds aren't designed to be permanently in use, right? There's a reason they don't use them always. Once we hit surge capacity, we know we're really in trouble. And I also want to just remind folks, we have to continue to be sensitive to human life. We can't be desensitized to this. So that while this is a threat to our hospital system and our broader economy, seeing these cases rise in this way tells us that there are members in our community that are falling ill to the extent that they have to be in the hospital, possibly end up in the ICU, possibly end up passing away. And that's why we have to work together right now to stem this trend so that it doesn't get to a point where we're truly about to run out of space, where we have to ask folks to stay home just as we did back here. And we can do that together right now by minimizing contacts. Go shopping in and out, somewhere where you're not going to be in close contact with people for a constant period of time. Go outside, a drive-in movie theater, bars, clubs, anywhere where you could be tight with folks. You're going to be sitting nearby folks that you don't live with for an extended period of time. Please avoid it. This is our time to change this trend and avoid our hospital system from eventually being overwhelmed.